Hi, this is Debbie Komisak giving a video presentation on the evidence-based practice case management. My chosen illness is childhood asthma. Asthma is a very common disease among children, more so in lower socioeconomic incomes, minorities, and urban populations, where 1 in 10 children are diagnosed with asthma. Evidence-based interventions found are found highly useful for the decrease in morbidity of asthma in the children. An example would be best practices included asthma care training kit. This is a training interaction for healthcare workers and children and their families ages 7 to 12. They attend 3 informative sessions in a group, and then they come together and share the knowledge that they learned together. This education has demonstrated a 43% decrease in hospitalizations and a 60% decrease in reduction of emergency room visits. There are many more that can be used in the community to nurture education in the children with asthma and their families, such as a comprehensive school-based asthma program. There's one called Open Airways for Schools, and there's one called Wee Weezers, which is an educational program in English and Spanish for 4 to 6-year-olds children with their families. Best practices need to be used for pediatric asthma due to the prevalence and morbidity and potentially even mortality of the disease, and also the financial considerations. Treatment should include patient education for trigger avoidance, medication adherence that enables the patients to carry on with their lifestyles without limitations due to their disease. The standard treatments commonly used include for mild intermittent asthma, a short-acting bronchodilator, to severe persistent, using a daily anti-inflammatory, inhaled steroids, and even systemic steroids. Education needs to be given to families on how to identify and avoid triggers, understanding use of medications, and the importance of compliance. Compliance is so important. I just feel in my own work and practice, so many families are non-compliant with giving their medication to their children and seeing the triggers and getting it done before it becomes status asthmaticus. The use of emergency action plans to identify when an exacerbation is imminent need to be utilized to intervene with a plan of action before the exacerbation comes about. Triggers and environmental control measures need to be addressed, from allergens to passive smoke, physical triggers such as exercise, to infections that can be identified and decreased. And as I said before, unfortunately, poor compliance is a major problem with the PEDS asthma management. Either the parents are not administering the medications regularly, or the children, especially younger ones, cannot manage to use a meter dose inhaler. They need spacers, and actually a spacer is a must for children under 6. The published guidelines are many and pretty much all repeat the same guidelines to identify triggers, reduce, eliminate them, and the proper use of medication. Educate, reevaluate. Asthma is a complex disease in children, and parents need a lot of education and follow-ups necessary. I feel case management is a vital to this population because it is so complicated, and the individual, it's not one precise treatment fits all children, and it's not all families learn the same way. So a nurse manager could be a great asset to the disease of asthma. There needs to identify which evidence-based practice guidelines will work best with each particular family. The nurse manager comes in contact with. from a study in 2015 of a multidisciplinary team of physicians, nurses, and respiratory technicians. They concluded that the clinical pathway of adherence to the National Institute of Health guidelines resulted in fewer hospitalizations and PEDS ED visits and exacerbations, and that was cited from the NCBI. Clinical pathways improves pediatric management in the ED and reduces admissions. Thank you.